I thought it'd be interesting today to talk to you a little bit about Invisalign, and in case you may have not heard about Invisalign, it is a method of straightening teeth that is different than the traditional orthodontic way of straightening teeth, which were band and wires on the teeth. Invisalign is a system of clear plastic aligners that look like this, and these aligners fit on your teeth quite snugly. If I demonstrate this, you can see they're difficult to get on, and then when you put them together they snap in place. So the way Invisalign works is it is a series of these clear plastic aligners that adapt to your teeth, and each aligner moves your tooth a little bit, and then aligner number 2 starts where number 1 left off, and number 3 starts where number 2 left off. So if you could imagine my fingers being your teeth and they're crooked, they slowly get straight by each aligner moving where the other one left off. You have to wear Invisalign all the time. That is the one drawback. The nice thing about it is when you wear them, obviously, no one even knows you're wearing them. They don't show. You can talk normally with them. We have teachers using them, professors at the university using them. You just do not know you're even wearing them. And people, we tell the story about a couple of our patients that were friends that didn't even know each other were wearing the braces all summer. They were at the pool with their kids, and finally one of them looked and said, "Are you wearing Invisalign?" And she said, "Yeah." And the other said, "Yeah, I am too." So you just don't know you're wearing them. So you can get straight teeth without anybody even knowing that the teeth are being straightened. The advantage, of course, of Invisalign is that it's painless. It is does it a very slow, uniform way. There's less chance of getting decay because obviously you aren't going to get food caught in the braces. The nicest thing of all about it is once you're done wearing these braces and you wear them, you get a result in a short, almost the same time, if not a little shorter than traditional braces, without anybody even knowing you're wearing them, which is probably the biggest selling point of the whole situation. As I mentioned before, the key to Invisalign is you have to wear the appliances 22 hours a day. You take them out just to brush your teeth and eat. Other than that, you wear them all the time. We do and can use them for teenagers in lieu of regular braces. The only drawback with that is they have to wear them. Usually with adults, they're paying the fee, they want their teeth straightened, you can count on them wearing. A lot of times with children, they don't really understand the advantages of straight teeth. So they sometimes do it because their parents want it done, and then if they don't cooperate and comply the way they should, we're out of luck. Whereas in traditional braces, if they don't cooperate, we have ways of getting them to wear rubber bands by putting springs on and things like this that they can't control. So for a compliant child, they're a very excellent choice. For an adult, they're a perfect choice because you can get it done again without even anybody knowing that it's done. The biggest concern only with Invisalign is making sure that you wear the aligners. That is critical. The other big concern is that make sure if you ever take them out, dogs love to chew on these, that you put them in little cases so that if you're ever leaving them and some dog gets it, then of course you're out of luck and we have to make you another tray, or you have to go back to your old tray before the one you previously worn. Invisalign Company was founded by a young graduate student who was dabbling around in things to do, and he kind of came up with the design, and has kind of revolutionized the whole orthodontic way of treating teeth for adults, because most adults would much rather wear a clear liner that no one is even wearing them than the traditional braces where everybody wears them. Traditional braces are a little more precise. They can get a little finer detail of movement, but most adults, when they want their teeth straightened, aren't looking for precise little minute things. They want a nicer smile, and many times Invisalign does that very, very nicely. Normally what Invisalign does is it allows us to correct people's teeth, and then after the initial correction, they allow us to do 3 refinements, which means when you do this, and we'll show you this in a few minutes, we'll put your case on a computer screen, and when the case comes up, then it's just a matter of you if you say, yes, I like the results, I like the way it's going to work, they'll show you how many trays that you need before you even start the case, before you're in an ideal situation. The only problem is, even though the computer will tell you you're going to be an ideal bite or an ideal relationship in, say, 20 trays, that isn't always the case. Many times the computer says that, but in fact your teeth don't move like the computer thought they were going to move. So all of a sudden 20 trays are up and it's not quite right. Well, no fear, Invisalign covers the bases, and they're saying, well, you can do 3 refinements for free. So we would take new impressions of your teeth after these 20 liners, let's say, and they'll say, well, to get them a little better now, it'll take us 5 more. And so you get 5 more trays, and you wear those 2 weeks at a time. And then let's say we're still not quite happy, well, then we can do another refinement and still another one after that. So we can get them awful darn close to ideal if you cooperate and willing to go through the whole gamut. The only little problem we found with adults is after one refinement, usually they look pretty good, and I might want them a little nicer, but they've had enough and they think they're happy. So I'd say 90% of the time we do 1 refinement, and probably 60% maybe 2 refinements, and not that often do we do the 3rd refinement, but occasionally it is done to get the results. I thought it might be interesting to look at an actual case and show you what a patient might see if they're interested in Invisalign after we take the impressions and pictures and send them to the company. The company then puts them on a website. We then would have you, the patient, come in with me, and we'd look at your teeth. And what these teeth, this computer picture shows, is a person's teeth. And if you see these numbers, they are suggesting, the Invisalign company, that we slenderize these teeth a little bit because it's kind of crowded. These little, we call them attachments, are on the teeth because it allows the clear plastic tray the ability to grab onto something and help turn or rotate the tooth or move it up and down. Your tooth, if you can imagine, is like an eggshell. You're trying to grab it and it's slippery and there's nothing to grab onto. These little attachments allow the plastic trays a little more retentive areas to grab onto the tooth and help move it the way they would like to do it. So when you look at this particular case, this lady is crowded, and they're saying needing some spacing to get the teeth crowded, or the crowded teeth straight. If you look at the teeth straight on, you can see that these teeth are fairly crowded. If you look at the upper teeth, that these teeth as well are fairly crowded. So Invisalign knows that they have to get it straight, and to do that, they're going to have to, rather than pulling teeth, we're going to have to disc a little off some of these teeth. We don't take the enamel away. There's still enamel on the teeth. It doesn't make the teeth sensitive. It just is a way of providing little space without having to extract teeth. So then what they say over here is they're saying 23 trays are needed in order to get this case done. Each tray is 2 weeks, so you're looking a little short of a year. Then what we do is we would show you that by pushing this button, what happens in a dramatic way. The case now just gets moved like this, and at the very end, or about 20 trays now, it all comes together perfectly. That moved kind of quickly. We'll just do it again in case you're interested in seeing it again. And again, it's a very slow, each tray being worn 2 weeks at a time to get all this done in a short amount of time. If you would then look at the upper teeth, that's the way they were when they're straight. This is the way they were when theirs began. Each tray is moving them slowly, 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 and then all of a sudden they kind of get squished a little bit back together and everything is straight. Do the bottom tray, same thing, they're straight there. That's the way when they're done. Again, we push the button to show people that it just moves them in certain ways and then tucks all the teeth back together. So it's a very nice, simple program to get straight teeth from crooked teeth with clear retainers and never having to know anybody, no one ever has to know that you're even wearing any type of aligners or braces to get your teeth straight.